Hi everyone, my name is Joe Hanson. I am the Cancer Champions Manager at the Rainbow Project. My pronouns are he, him. And we're here today at Antrim Area Hospital speaking to some of the radiography team to answer some of your questions that we've gathered on breast screening. Let's start with, how do I self-examine my chest? How will I know if there's a change and who do I contact?
So we have leaflets available in our department that you can refer to look out for awareness and changes. Also, you can check the Public Health Agency website where there's more information. There are a lot of online resources, but if you do notice anything different for you, you contact your GP and they will refer you to our service here in Antrim Area Hospital.
And can you explain for me the difference between the breast screening unit and the breast imaging unit?
So the breast screening service is for anyone registered as female from the age of 50 to 70. You'll be called every 3 years for screening. This is just a routine service that is available to everyone, so it's not that you would have a symptom that you're concerned about. The breast imaging unit that we have, this is where you go to your GP if you have any kind of symptom or change in your breast or your chest. Your GP then refers you here, so that's the difference between the two. Yeah, so the breast imaging unit would be like a one-stop clinic. It means you get all the imaging done on that day. You'll see a clinician, and if any tests are needed, then they're done on that day.
So I'm registered with my dead name with my GP and I'm worried about being misgendered. Is there anything I can do to help the staff know before attending the clinic? Are there any reasonable adjustments that can be made?
So we include our number on every letter, so if you would like to make us aware of any adjustments that you need, you can just ring us ahead of your appointment. The admin staff will then let us know if there's any changes or anything that you would like to be known to us, and we'll know that ahead of your appointment and be able to make the adjustments for you. So that includes if you need any adjustments for any case, if you would like more time for your appointment, if you are in a wheelchair, or if you have limited mobility, we can make extra time and help you along the way there.
I'm not receiving any routine screening letters or invitations, but I think I might be eligible. How can I go about getting a screening appointment?
This is something that you would need to talk to your GP about. So you can make an appointment with them and discuss this, and if you think that you're eligible, then they will be able to make a getaway to make sure that you're being invited for your screening.
I have some past trauma and dysphoria surrounding healthcare appointments, so sometimes I am anxious about my body and it takes longer to access appointments. Would I be able to get an appointment at a quieter time or have extra time to go over any concerns?
Yes, you can. If you want to phone us ahead of your appointment time and just explain your concerns and how anxious you are, we can make arrangements and give you extra time so you can have your appointment at the end of the day when we're not as busy, I suppose, and the staff will try and help you through your anxious concerns. A mammogram is quite an intimate examination, so there is physical contact. So as long as you're aware of that before you come, and we will try and alleviate some of those anxious concerns that you have.
Can I bring someone with me to help support me?
Yes, of course. You can bring a carer or comforter along with you, that's not a problem. And there's room for them in the examination room if you need them to be there.
Can I wear my binder to screening? I'm worried about changing spaces. Are they private or public spaces, or are they gendered?
You can wear your binder to your appointment, although you will have to remove it for the examination with the consultant at the beginning of the appointment. And it's probably best to keep the binder off then as you come through the imaging side of the appointment. We do have an examination room where you will be able to change, and it is quite private, and you can take as long as you need in there.
I'm intersex and therefore have variances in sexual characteristics. Will I be able to attend the screening, and if so, is there a gender neutral space for me?
So for breast screening, you have to be registered as female and registered with a GP to avail of the appointment, and that's how we get you to come into the service really. For the symptomatic breast imaging service, we avail of all genders, and everybody's can avail of that service, but you have to be referred via your GP or your gender clinician.
Can I wear deodorant to my screening?
It would be best to avoid deodorant because sometimes it can interfere with our imaging, so it can show as artifact on the x-ray, so it would probably be best just to avoid it if you can for that day. If you want to wear it though, we can wipe it off just before your appointment.
I have had breast implants, but am I eligible for screening? And I would like to know if that's still possible for me.
Yes, it is. For implants, we do an extra image for the mammogram. We also get you to sign a consent form if you do have implants in situ, just to cover everything that would be different for the mammogram.
I have had top surgery. Is there any need for me to come for a breast or chest screening?
Yes, there is. You would need to talk to your gender clinician about how much breast tissue you have, and it would be up to them to refer you to what type of imaging that you need to have done.
I have started taking estrogen and only have a little bit of breast growth at the moment. Should I still go for screening?
Yes, screening is still a good idea to come and attend your appointment if you're invited. So for breast screening, you need to be registered as female and registered with a GP. And as long as you fit into that category, yes, you should still come for your screening mammogram.
Do you have any information on screenings for trans, non-binary or intersex individuals?
Yes, we do. So the Public Health Agency have devised a leaflet screening information for transgender, non-binary and gender fluid service users. That is available on their website. We also have some in the department here that you can avail of. Macmillan Cancer Support and the Rainbow Project have good resources that can be found on their websites as well.
I think one of the biggest things that it does is that it helps remove barriers for people trying to access different parts of healthcare, especially for the trans community. There's a lot of times where the trans community feels like there isn't a space for them to access any healthcare. So having even just a leaflet there, even just with the trans flag colours, can make them feel a bit more represented.
I think visibility is the main goal. Again, making sure the community feels connected. There can be a lot of barriers when accessing lots of different things for LGBTQIA+ people, particularly the trans and non-binary and gender diverse community. So I think it's really important that that's there. Even if it's just a little nod, it just makes someone feel so much more validated and accepted within society. And just, yeah, that visibility is just really key.
I feel like it's so important because there are so many people who have faced challenges, barriers, maybe had a really difficult visit with the GP, maybe had a tough conversation around healthcare. And I think it's so important that we know that there are so many amazing services that are inclusive, that are supportive, that professionals who have dedicated years to this work know exactly how important it is that everyone gets screened, that everyone has the opportunity to have a really positive experience with healthcare. So I think until we create and we make these resources that show inclusive and accessible services that are there for everyone, we're still going to have a lower uptake of those services because of some of those early challenging experiences that we know people have had and do face. And so that's what we're trying to do with this series. We're trying to create those spaces to show that there are services for people that are really positive, really inclusive. We really want to show that early detection is early prevention and that screening is for everyone.